Hi, it's Atul Kamath. I wanted to talk to you a little bit about what we call biologics in orthopedic hip and knee care. Want to look at some of the therapies offered, look at some of the risks, and of course the benefits from these biologic therapies. So in recent years, orthopedic care has transformed dramatically with the introduction of biologic therapies. These advanced treatments augment or amplify the body's natural healing mechanisms to treat various musculoskeletal or orthopedic conditions. With treatment methods like platelet-rich plasma, also known as PRP, and bone marrow concentrate gaining popularity, many patients now seek these regenerative medicine options for joint pain relief. So biologics represent a significant change and shift in orthopedic medicine, especially for hip and knee joint care. I routinely use biologics to augment key procedures like cord decompression for avascular necrosis of the hip and knee, hip arthroscopy and hip preservation procedures, as well as cartilage repair procedures. Here I'll explore some types of biologics, their applications, the benefits of these therapies, and any potential risks involved. So to discuss some of the types of biologics used in orthopedics, they include various products derived from living tissue, and often derived in cellular, meaning from cells, and also from acellular, meaning outside of cell therapies. Both types aim to promote healing and tissue regeneration. Often these tissues are just taken from the patient itself at the time of the procedure, so they what we call autologous or from your own body. The first one is platelet-rich plasma or PRP. PRP is among the most recognized biologics out there. This treatment starts by drawing a small amount of your own patient's blood. Then it's processed to isolate or separate out platelets, which are rich in growth factors. These growth factors promote healing when injected back into affected tissues for healing or to augment or repair in orthopedic surgery. These concentration of platelets enhance the healing process, leading to potential improvements in pain and function. Certain studies show that select patients, for example, with knee osteoarthritis, report pain relief after PRP therapy. Another type of biologic is what's called bone marrow concentrate. Bone marrow concentrate is derived from the patient's own bone marrow and contains growth factors and other stem cells. This concentrate can help repair damaged tissues and encourage even bone regeneration. Research indicates that using bone marrow concentrate in treating certain conditions like osteoarthritis and avascular necrosis can lead to improvement in pain and function. Other types of biologic tissues that you may encounter are things like amniotic fluid or tissue grafts. Amniotic fluid and tissue grafts are also utilized in both non-surgical and surgical orthopedic care. These materials contain numerous growth factors and have anti-inflammatory properties as well, so make them effective in treating various orthopedic hip and knee joint conditions. With these diverse biologics available, orthopedic practitioners can customize treatment plans tailored to individual patient needs, increasing the chances of your successful outcome. Applications of biologics in orthopedic hip and knee joint care and surgery range from non-surgical to surgical treatment options. The use of biologics in hip and knee joint care really has gained a lot of momentum due to their potential to increase function and reduce pain. One specific condition or application is the treatment of osteoarthritis or wear and tear arthritis. Osteoarthritis is one of the most common degenerative joint diseases, and it heavily impacts the hip and knee joints. PRP and bone marrow concentrate therapies have shown effectiveness in lessening inflammation and stabilizing cartilage damage. A clinical study, for example, found that patients receiving PRP for osteoarthritis experienced a 40% improvement in their mobility and quality of life within 3 months for early onset disease. Another application for biologics is sports injuries. Sports injuries are often encountered by athletes who may affect injuries to their hip and knee joints. These can be direct injury to the joint or injuries around the joints of the ligaments, tendon, and bursa, or the cushionings of the joints. So biologics play a crucial role in speeding up recovery times. For example, studies that involve tendinopathy or injury to tendons around joints when receiving PRP treatment have had recovery durations reduced by up to 20% compared to traditional rehabilitation methods. Other applications for sports injuries, including the biologic therapies in combination with preservation procedures like hip arthroscopy or addressing focal cartilage defects in the hip and knee. So surgical applications then are increasingly used in surgical contexts such as knee arthroscopy or hip arthroscopy in carefully selected individuals with otherwise healthy joints. Using biologics in these surgeries may lead to improved healing rates and better integration of repair tissues. These applications highlight the versatility and potential of biologics in addressing various orthopedic issues. Some of the benefits and potential risks I want to also discuss with regard to biologic therapies. The advantages or benefits are notable. It's minimally invasive. Many biologic treatments involve outpatient procedures or procedures that can be done in the clinic setting. There's usually minimal recovery time. For some of the percutaneous or injection type procedures, simply a Band-Aid is needed. I tell patients to ice or rest the affected joint for the next day or so after the procedure, and then slowly work their way back into their routine activities. Some of the treatments and other benefit may be the reduced need for surgery. In certain cases, biologics can relieve pain and restore function without the patient resorting to more invasive surgical methods. And then a lower risk of complications. Many biologic treatments use the patient's own cells, which lowers the risk of anything like rejection or complications like infection or other issues related to using other tissues. And some of the risks need to be discussed. Despite some of the advantages, some of the drawbacks include variable effectiveness. So the response to biologic treatments can differ from patient to patient. Some patients may experience significant improvements with these therapies, while others may see little to no change. Early stages of disease, like early stage arthritis, respond better to biologic therapies than more late stage or advanced arthritis or other orthopedic conditions. The effectiveness is also likely patient dependent. Other factors like genetic contributions are also being actively explored in our response to biologics. I did mention earlier the small risk of infection. Any time a procedure is performed, there is a small risk of things like infection at the surgical site. This would be very rare. In my practice, I have not seen this directly from an injection in the clinic using biologics. There's also cost considerations. Biologic therapies are often not covered by insurance, and so you must check with your provider, your hip and knee specialist providing these biologic injections for any out-of-pocket payments. So understanding the potential benefits as well as risks of biologics is vital for you to consider when contemplating these treatments. So looking ahead, I think the future is bright for biologics in orthopedic hip and knee care. As biologics continue to gain traction, they offer hope for individuals dealing with hip and knee joint issues. With treatments like PRP and bone marrow concentrate leading the charge, many patients are discovering effective and less invasive options for pain relief and improved joint function. However, it remains crucial for patients to engage in an open dialogue with the orthopedic specialists, like those at Orthopedics, to determine the best treatment plans tailored to their individual needs. Careful consideration ensures that patients are well informed about the potential benefits, as well as some of the risks, including costs of these innovative therapies. So as orthopedic advances, the promise of biologics paves the way for healing and regenerative therapies in hip and knee joint care. With proper guidance and informed choices, biologics could hold this key to a more active and pain-free future for those facing orthopedic challenges. We'll see you soon at Orthopedics.